I know people throw around the word narcissist.
Tell me who's the narcissist.
And the internet has been gaslighting me.
And I feel like you're gaslighting me.
There are over 32 million mental health posts on Instagram. On TikTok, the tag has over 15 billion views. But not all of those are full of factual, medically sound information.
Mental health has become a trend.
Still, experts say this online mental health movement can benefit people who may have otherwise felt alone.
People with multiple psychiatric disorders are benefiting from these online forums where they get to talk about their experience and receive peer-based support.
Because we do have more, therapists of color on social media, that it also has provided a way for people to see that we do exist and that there is representation.
Drs. Shala Modir and Erlanger Turner both say the openness and vulnerability of mental health conversations on social media have lowered stigma and increased access to mental health support and information. But with great follower counts comes great responsibility.
Be scared, don't be shy, come on in, the water's fine.
Just ask Courtney Tracy, a licensed clinical social worker and psychologist who now works full-time making informational videos about mental health for her 1.7 million followers on TikTok, Instagram, and YouTube. She is among a growing number of experts sharing content that debunks misconceptions from online influencers who don't have mental health credentials, often sharing misinformation.
They may give their own perspective or pull a random fact or figure, but share it in a way that actually makes it false information, not necessarily maliciously, but just unintentionally.
The dark side comes in with incorrect, casual use of serious terms like gaslighting or narcissist.
Narcissism and gaslighting have been taken out of context, used socially to inflate or exaggerate situations.
Over the past decade, online searches for both terms have skyrocketed, but the way they're being used has leaned towards casual expressions that misinterpret everyday behaviors instead of clinically accurate symptoms or syndromes.
I've seen it used in a way to almost kind of weaponize it in an argument amongst people online at times, where they're trying to invalidate the other person by just calling them a narcissist.
And intentions aside, they can do true harm, causing more stigma to conversations about mental health or hurting people who have actually experienced abuse and gaslighting.
They may feel like people don't really understand their reality and sort of the hurt that they've experienced as a result of that.
It all comes down to asking yourself, who is giving me this information? Before you save and share that video or meme, experts say check the poster's bio, which should include credentials. Also, most legit clinicians will have a disclaimer that their insights should not be a replacement for proven, individualized mental health treatment.
Instagram and social media is not typically a two-way communication stream. Like, make sure that you're double checking what is said, just so that you can make the best informed decisions for yourself. That's what's most important.
Experts tell Newsy there's a few more misused terms showing up on social. First, high-functioning depression or high-functioning anxiety, which isn't a thing. Mild depression or mild anxiety would be the more accurate way to classify either condition. The other misused term, antisocial. That is a serious personality disorder experts say is oftentimes confused for asocial, the behavior of preferring time alone instead of with others. Lindsay Thies, Newsy, San Francisco.